Welcome to this lecture about the disorders of the lymphatic system. The objectives for this lecture are to discuss the disorders of the lymphatic system, lymphadenopathy, and lymphedema. And we'll have a look at the pathophysiology, the treatment, and the nursing care of your patients with lymphedema. So first of all, what is lymphadenopathy? Okay, well, lymphadenopathy means large or swollen lymph nodes, and that's because of an increased proliferation of lymphocytes and monocytes, which can be for a variety of different reasons. It can be due to invasion by malignant cells, and we can have generalized lymphadenopathy, and that can be associated with infections such as glandular fever, or we can have localized lymphadenopathy, which can be just a throat infection causing swollen glands here. As you can see, the image in front of you is a very good example of what generalized lymphadenopathy would look like. We can see there's lymph nodes swollen everywhere here, and he's got the inguinal lymph nodes. It's very obvious on this image. And often the generalized lymphadenopathy can be related to malignant disease as well. Now let's have a look at lymphedema. Lymphedema is a primary or secondary disorder due to inflammation, obstruction, or removal of lymph nodes. And often lymph nodes can be surgically removed due to cancer. Now I'd say this image here is very typical of a lady who may have had lymph nodes removed due to breast cancer, and they will present like this, where they'll have one normal arm here, and then they'll have lymphedema in the other arm, and that's because the local lymph nodes up here, the axillary lymph nodes, have been removed, so the fluid from this arm is not being able to be drained effectively. Now in this case, we usually find that edema begins distally, so over here, and it progresses slowly up the arm, up the limb towards the heart. Now it's supposed to be painless, but as you can imagine, it would feel very heavy and uncomfortable as well. Now there's also a congenital lymphatic anomaly known as Milroy's disease. Milroy's disease is a genetic lymphatic disorder that results in lymphedema, but this usually affects the lower legs and feet, and it's usually bilateral. So what treatment can a patient with lymphedema have? So very important to educate the patient about elevating their limb, as this aids lymphatic flow. So we're using gravity really to drain the fluid back into the venous system. Okay. Now surgery may also be an option, and it's fascinating. They can actually join the lymphatic vessels and the veins together. So the fluid leaks directly from the lymph vessels into the venous system and drains away. Now patients with lymphedema are also encouraged to exercise where possible. That obviously depends on the cause of the lymphedema and whether they are able to exercise. But it could be something as simple as raising and lowering the affected arm to get some movement of fluid there. Very important to keep an eye on the sodium intake as well, and encourage a low sodium diet, as that encourages less fluid to build up within our bodies. And a special lymphatic drainage massage can help to rid the limb of the excess fluid. As can diuretics, they can systemically drain any fluid. Now, patients with lymphedema will need exceptional nursing care. So, thorough skin care is so important with patients with lymphedema. We need to clean the skin, we need to dry it thoroughly, and we need to moisturise, especially in between the fingers and toes. And that's because the fluid congestion in the subcutaneous tissue leads to it becoming really fibrotic. There may also be a buildup of foreign materials and pathogens in the subcutaneous tissue due to the lymph nodes not filtering the fluid. So your patient will be at an increased risk of developing cellulitis, which is a bacterial infection of the skin. And of course, cellulitis can lead to sepsis, and sepsis can kill your patients. So that is why essential nursing care, really good skin care is so important for these patients. And we can also help promote lymphatic drainage. We can do so by using the compression stockings or the special compression bandages that can be used, and the pneumatic devices that we see around the acute setting. And as simple as elevating the limb, we can use the amazing beds that we have now, the electric operated beds to raise the legs, modified Trendelenburg position we can use pillows as well, or footstools if our patient is sat out in a chair. So we can use elasticated graduated compression stockings for the legs, and we have special compression bandages for the arms. So we need to monitor the size of the affected limb. We can simply use a measuring tape for that. Now, just a top tip when you are using a measuring tape, always draw a spot on the arm where you actually went around. So you're measuring the same spot each time. If it's an arm or if it's a leg, try to go around the biggest section of the calf. And we also need to monitor fluid balance and weight of our patients. Now, if the reason why we monitor the weight daily is because if there's a sudden increase in the weight by 2 or 3 kilos, you know that they've actually gained too much fluid, okay? It's also very important, as with anything, to educate our patients, educate them about what we're doing, what is wrong with them, what they can do to help. Elevate the limb when they're sitting down, have a low sodium diet. They may be able to do some lymphatic drainage massage themselves. A lot of patients with breast cancer are able to do that themselves. And it's very important to offer psychological support to our patients as well. They will have a distorted body image, so we need to offer them guidance and support to get through this. Well, I hope you have enjoyed this lecture about lymphatic disorders, and here are your references if you would like to do any more reading around the subject. Thank you.